Well, most people wouldn't think twice if their GP asked them to get a blood test. But a leading not-for-profit health organisation is calling for greater conversations between patients and healthcare professionals to reduce unnecessary tests and procedures. Dr. Robyn Lindner is from NPS Medicine Wise and she joins us now in the studio. Welcome to Afternoons and thanks for your time today, Robyn.
Thanks for having me.
You looked into a range of fields: gastroenterology, cancer, genetics. Let's break down some of the specific tests that you're wanting patients to reconsider. I'm kicking off with celiac disease.
Yeah, so particularly this is about genetic testing for celiac disease. So about 30 to 40% of Australians carry the gene for celiac disease. So if you have a genetic test, you'll test positive, but only about 1 in 100 people will actually develop celiac disease. So if you get a positive result for a celiac test, a genetic test, it doesn't necessarily mean you're going to develop the disease. So it can create a lot of anxiety that isn't necessarily warranted.
Okay, and sticking with genetic testing,
Yeah.
Alzheimer's can be tested as well. What are some of the problems with doing an overall genetic test for predispositions towards illnesses?
Yeah, well, some of the complexity is particularly the idea that people are doing responding to direct-to-consumer marketing. So people are sending off samples and getting test results back and not having the value and benefit of having a health professional there to interpret the results. And so a positive test result for ApoE, which is a genetic test for Alzheimer's, it means you're at risk of developing Alzheimer's, but it doesn't mean you will develop Alzheimer's. So again, you might have that false anxiety that can come with having a positive result, but also simultaneously there are other things that can cause Alzheimer's disease as well. And so if someone gets a negative test result, you might almost be getting false reassurance that you won't develop the disease. So it's much better to talk to your doctor about whether you should even have a genetic test, and then if they think that that's the best thing for you, you've got their guidance in interpreting the results.
Okay, colonoscopies also came under the microscope.
Yes, so colonoscopies are a really useful test for diagnosing bowel cancer and examining the bowel, but there are risks associated with them. They're small, they don't happen very often, but there are risks such as a risk of perforated bowel or infection, and so you don't want to be having them more than you need to. And so the recommendations coming out this week from Choosing Wisely recommend only having them as often as is recommended by the guidelines put out by the National Health and Medical Research Council.
Shouldn't the GP that you're seeing, though, advise you of the potential risks of a procedure like this?
Absolutely, they should, and I would imagine in most cases they do. But sometimes, for example, guidelines change. So this is a way of alerting GPs what the current guidelines are, because as we get more evidence over time about the appropriate use of tests, guidelines change. So this is a way of letting GPs know what those guidelines are. But also sometimes patients have expectations that they think a particular test is useful, and if one doctor doesn't provide it for them, they'll go and find another one that will too. Yeah. So it's a two-way conversation that needs to be had.
Okay, you also looked into sexual health and
Yep.
what people should be testing, and indeed how they should be testing for certain ailments such as chlamydia, herpes and thrush.
Yeah, so with things like herpes and chlamydia, the recommendations are particularly around a particular type of test, and that is a test that measures whether you have the antibodies for those infections. And they're not a very specific test because it can't differentiate between whether you had had an infection a couple of years ago or whether you've got it now. And so there are much better tests to be had to diagnose whether you've got chlamydia or herpes rather than those serology tests.
And thrush is an interesting one as well, isn't it? Because a lot of women are almost self-medicating, which could be to their detriment.
Yes, so women who might have persistent vaginal thrush, it's recommended that rather than just keep going to the chemist and getting some more, antifungal ointment to treat it, you're better off going to the doctor because you want to check that it actually is a fungal infection. It could be being caused by something else, in which case you might be on the wrong medication. But if it is fungal infection, you want to make sure that you're not developing resistance to that.
Okay. So given that these guidelines are changing over historically and have changed recently with these new guidelines set, does it necessarily mean that doctors have been ordering unnecessary tests for their patients?
Not necessarily. I mean, as I said, yeah, guidance changes over time. New technologies become available too. There's constantly new tests becoming available as well, and so it's sometimes challenging for people to be aware of what the guidance is around new tests. And people are becoming much more health literate too. So people sort of go online and find out about particular tests and have expectations about what they think is going to be appropriate for them.
Well, and finally, there was cancer management and treatment was looked into, and I think the stats are 1 in 3 Australians by the end of their lives will have had cancer of some sort. You've looked at prostate cancer and breast cancer, and perhaps looking at alternatives to radiation immediately, is that right?
Yeah, so with men who've been diagnosed with low risk prostate cancer, and I really emphasise low risk, it's recommended that people talk to their doctor about whether active surveillance is an option for them. And so that means that you might avoid invasive treatments that can have side effects attached to them. So that's an option for men that they should talk about with their doctor. The recommendations around managing breast cancer, invasive breast cancer in women, relate to the level of radiation treatment that women can be exposed to. And it's a great example of where now those treatments have been around for a long time. There's greater evidence that shows that actually you can have a shorter period of radiation and get just as effective treatment of the cancer as a longer treatment. So that's a great outcome for women, to know that you don't have to have as much radiation.
Robyn, before I let you go very briefly, this is really just all about starting a dialogue, or indeed fostering a better dialogue between patients and GPs. Is that right?
Absolutely. It's about recognising that every test has a benefit, and every test and treatment has a benefit. They also have risks, and those benefits and risks are going to be different to you than they are for me. And so you need to have that good conversation with your doctor to work out what's most appropriate for you.
Dr. Robyn Lindner from Choosing Wisely, thank you very much for your time.
Thanks for having me.